You have reached source of information. Welcome this afternoon. All of you that's listening, I thank you for taking the time to tune in. We're going to talk about some benefits that are very important to you. And the benefits that we're talking about is Social Security benefits, early retirement. There's a number that for early retirement that last time we talked about early retirement, we didn't get into it. So I want to come back and make sure you guys have that information. The information that I'm talking about is the amount of your check is going to be reduced by if you take an early retirement. No, I'm sorry. I'm doing a couple of things at the same time. The amount that we're talking about is the amount that you're allowed, the limit for 2024 that you're allowed to make before they start holding any money for you. Okay. For early retirement 2024, the income limit is 22,350. If you make anything above 22,350, for every $2 that you make above that, they're gonna hold. Again, the word is hold. They're gonna hold a dollar for you. Now, the way they're gonna go about holding that dollar for you is they're gonna take it from your Social Security check. So let's say, for example, you getting $1,000 a month, and you make over, I say 22, and you make $10,000 over that amount. Well, they're gonna hold 5,000 for you. So for the first 5 months, from Monday to May, they're gonna hold $1,000, and then, of course, the May check is really the March check. So you're gonna start receiving payment starting June. Remember, the June check is really May's check. So you're gonna receive a payment from starting June, and then it will continue. The following years, let's say they've increased the limit. So let's say they increased the limit by another $1,000. So it's 23, and you work the same amount. So now you're not over by 10,000. You're over by 9,000. Same process. They're gonna hold 50% of that amount, and then they'll distribute it for a number of months, which at that time, that what they will do eventually is combine that year, or they may do it every 2 years, combine those 2 years, and write you and let you know that they made an error in calculating your Social Security benefits. The new amount is going to be this. You might, if they would hold it for 2 years before they made the adjustment, then at that point you may get a lump sum up front. If they are doing it from year to year, year after year, then you may not get a lump sum up front, but they will tell you that in the mail that they sent you, that your Social Security benefit is going to increase by X amount. First of all, let me say welcome to every one of you that's listening. Anyone, if you have any question, I am at the studio today in Miami. So you could reach me at 305-945-1580, 305-945-1580. The line is already open for you. You who have a question, we're going to make sure that all the lines are free, so that we make sure that your call is coming through. So all the lines are free right now. If you have any question for me from previous shows, You're welcome to call in and ask the question, whether in English or Creole. So, again, the number is 305 945 1580. 305 945 1580. Okay, so while we're talking about early retirement, remember early retirement for everyone right now is 62 to 66. A vast majority of you really right now, if you were born in 1950, 58, it's 66 and 8 months. If you were born in 1959, it's 66 and 10 months. Everybody that's born after that, from 1960 on up, you will your full retirement age is 67. Full retirement age for you who was born from 1960 on up is 67. Okay. Well, we're gonna dive into the early retirement, and then as we get calls or not, we're gonna really get into more information. One of the things that I really I want to get into later on today is in terms when you go to a doctor, what to expect. I don't know if we covered that last week, but I think it's very important that you know exactly what to expect once you go into your first visit to the doctor. And if I did talk about that last week, then that information, it's never too much because in the clinic it seems like we run into the same thing over. In fact, this morning the administrator was suggesting that I talk about it so that when you guys come to your visit, you know what to expect and you know what to bring with you. So we'll get to talk a little bit about that in a little while. So for early retirement, as I was saying, now remember, if you take an early retirement, when you reach the age of 65, automatically they will send you the Medicare card. And when they send you the Medicare card, the only thing that you really have to do is simply basically call me 954-667-4885, 954-667-4885. Then we'll walk you through the rest of the process because it is really it's a challenging. I would say if you don't know, if you don't have the information, I dare to say that if you have not been listening to source of information for the past 6 or 7 years, then you're going to be dead in the water. We bring the information to you, and so that you know what to expect. Right now, there's not a day that go by I don't get someone that comes to the office or call me and said, I'm getting a lot of mail. Yes, you're going to get a lot of mail once you're getting closer to that 65. You're going to get a lot of mail, whether it's from AARP, whether it's from other company. Like the gentleman came to the office earlier and brought with him two cards. But those people, they were selling supplemental insurance. And we'll get into that, and I'll let you guys know about the supplemental, the difference between having it, what's the good, what's the positive about it, what's the negative part about it, and do a comparison with the Medicare Advantage plan. We'll talk a little bit about that in a little while too. So you will get mail from different companies. You might even get people calling you. But you have to be very careful about who you let in your circle. You have to be very careful who you are sharing your information with, because there's a lot of individuals that don't mean well. So there's a lot of individuals that's out there. Their motive probably is just to con you, or their motive is probably just to make that first get that first paycheck, and then after that you'll never hear from them. That's not what you want. What you're looking for is someone that when you need when you're in need for something to get done, whether it's an appointment that to set for you with your primary care physician, whether it's you having some issue with the office, that you need somebody that's going to stand up for you and navigate the system. The healthcare system is very complicated for someone who have no knowledge about healthcare, and it's not about education. It's not about education. I've sat down with doctors, lawyers, um, and they are a master in their field. But when it comes down to this area, they don't have too much knowledge about it. So we all are, and that's why we all specialize in a certain area, because that particular area we could concentrate on it and be good at it. So the healthcare industry is very, very, very complicated. So we here to take out the complication out of healthcare and to bring it down to you, simplify it. Simplify a bit where you can understand it. Okay, talk to you as put it in a way that you can understand it, and when you understand it, then you could stand for your right. You know what to expect, and in most cases, I dare to say that you probably will be a much better patient, because when you know what to expect, when you go to the doctor, there's no bill, so you make sure you go to your appointment. You know that if the center is offering transportation, when you call, when they set up your appointment for you, you make sure that transportation is scheduled. And after a while, once you become accustomed with the center, then those are the things that they're going to do for you automatically, because they know. 305-945-1580, 305-945-1580. So those are the things that you want to be concerned about once you're ready to pick a plan, because as I explained to you guys in the past, one of the things that you must do once you get the Medicare card and you look at the card, there's Part A and Part B in there. And Part A is for hospitalization, Part B is for physician, doctors. Then your next step is to make sure that, yes, that card, you don't hold it. You call me, 954-667-4885, 954-667-4885. Then we'll sit down, we'll guide you. Because we want to make sure that, one, remember there's $174.10 that's going to be coming out of your Social Security check or deposit. That's the way it is right nowadays. $174.10 going to come right off the top, and you'll get the rest. But do you know that if you below the income guideline that they set, then you will be able to, you could be eligible to get Medicaid. And that's not a bad word. Because once you have Medicaid, then the state going to pay that's $174.10 for you. Now you get all your money back. That's very important. And with the Medicaid, along with that, there's a merger that's going to be done with Medicaid and the Medicare. And then we're also going to merge the Medicare Advantage plan with it to make sure that when you go to the hospital, when you go to your doctor, there's no co-payment. One of the great things that when they came out with Medicare Advantage plan is that it also covers your deductible. Yes, there's a deductible with Medicare, You don't hear people. You don't hear anybody talk about it. It's simply because that it's taken care within through the Medicare Advantage plan. Now, whether the Medicare Advantage pays it or not, that's one thing. But we know that the patient doesn't have to pay for it. You never get a bill for Medicare Advantage plan. You never get a bill for $1,125 and says this is the deductibles that you have. So when you go to your primary care, you'll get they'll charge you X amount. No, because that's not the case for you. So there's a lot of things that you want to make sure that once you become eligible for Medicare, that you have the Medicare Advantage plan. You have the low income subsidy that's going to help you with your prescription drugs. You have, we talk about low income subsidy, we're talking about Medicaid. So you have those four items together. And so when we put all of them together, now you're able to get a plan that's going to cover you thoroughly. And when I mean thoroughly, it will cover you from head to toe. It will cover your doctor's visit, your specialist visit. You'll be covered for dental, optometry, and hearing. That's something that Medicare by itself do not cover. So it's vitally important that you get together with the right person, a person that's knowledgeable about healthcare. About maybe 10 years ago, when they had it's longer than that. I think it was 2008 when the market crashed, something like that. At that time, you had people that was leaving real estate company to come and work for health those Medicare Advantage company, because for that open enrollment time. And by the way, we are actually right now in a different open enrollment, which we'll talk about that also. So during that open enrollment, they left whatever they were doing just to switch over there so they could make money. So, and at the time they were getting about, I believe about $800 to $900 per application. So you want to make sure that the person that you pick, first of all, professionalism is number one. Somebody that you're able to get in contact to, or if you call, they return your call. There's a lot of people that if they're not doing well, they leave the business afterward. You don't hear anything about them, and when you need service, you can't get service. So make sure you pick the right person. Make sure you pick me. That's the right person, and I've been doing this for a long time, and I'm not going anywhere. I'm not going to go anywhere, and we're gonna provide you with the information also, so you could make the right decision. So we said that we are currently on an open enrollment for everyone that, for some reason, did not have or did not apply for a Medicare Advantage plan on time, or they lost their Part B, or never applied for Part B. Right now, this is the time that you could do that. From January 1st to March 31st. You could apply. There's quite a few things they're going to ask. And when I mean quite a few things, for example, if you have insurance through your job, if you had prior coverage, they're going to ask for that information. And it's a matter of fill the application, send it in, and then you will get your Medicare card in the mail with showing their eligibility for Part B. But the Part B will be eligible July 1st. So what you can do by June, you make sure that you you don't miss the deadline. By June, you apply with a Medicare Advantage plan, so that you could be effective July 1st. Now I know I'm throwing a lot of information at you guys, and without a break, I'm going to take a break right now, and then we return in a few minutes. When we return, we'll cover the part with the doctor, what you should expect when you go to the doctor. Okay. So you listen to Source of Information. I'll be back in a few minutes. 1580 305 945 1580. If you have any question, please call me, and I'll be more than happy to answer your question. So we were trying to talk about when you go to your doctor for your first visit, what should you expect? I usually take the guys for example because most of the guys tend to skip that part. They skip going, getting um, that examination. Skip from the part about going to the doctor. A lot of guys will tell you, I don't like going to the doctor, but it's a necessity. It's a necessity that you check your with your doctor. If you're healthy, at least twice a year, and especially if you haven't done so, then yes, you should do so because first thing that the doctor's going to do, they're really going to do a complete physical for you from head to toes. Check your skin, um, check your vision, check your ear. Make sure that from the lab is very important. You may not do the lab the same day. You'll have to maybe in certain cases you could do the lab the same day, and within 24 hours they'll have the answer. They will check one of the most important things. I think you heard. I think it was Dr. Samuelis that talked about that. How to check underneath your feet because as you get in age, what happens is that your metabolism is react much slower. You develop um, whether it's high blood pressure, cholesterol, diabetes, and those three are very common. And if you've been listening to the show for a while, you hear us talk about that. And I think in the coming days, we're gonna be. Hopefully, I could bring someone during this hour to speak in English and about certain health benefits. I know that we've been our main audience. We've been targeting. We've been concentrating on our Creole speaking, and there's a reason for that because our population is they are behind. There's a verse in the Bible that says my people are dying from lack of knowledge. So that's why what we're trying to do is um, they're perishing because of lack of knowledge. It's an actual quote. So when we started, we wanted to concentrate providing them with the information, and I think over the years we have done that. But we also want to get to reach the English market to educate them as well. Um, because at first I thought that yeah, the English it's easy. The English speaking individuals they have the information. It's a matter of go find it, but that's not the case. That's not the case because we find out a lot of people don't have access to that information, and so they don't know what to do. So yes, the doctor's going to do a complete physical check underneath your feet. Um, Once you develop diabetes, then of course there's other things that affect on it. You heard us talk with Dr. Simmons about that. Your heart is affected if it's not if it's not regulated. Okay, some people have their diabetes out of control, and what I find out with diabetes is what it is what you're eating, what you're putting in your mouth. We're not going to get into the medical aspect of it because um, we want to concentrate with just the benefit part and leave that part with the doctor that could speak and with more authority about it. So yeah, while you're there, and if you're taking any medication, when you come into your visit, bring that information. Bring a list of a medication that you're taking, or better yet, bring all the bottles so that the doctor could look at them and see exactly what you're taking. My experience is that you have, especially the elderlies. At one point, we had one pharmacy that was constantly bringing a medication, and they would not read it, and before you know it, they don't take it, and when the medication is sitting there, there's a bottle that's full, and they mix and max. So before you know it, the bottle is full, and now they taking that same medication twice when they were meant to take it once. So that's why it's important that when you come into your appointment, you bring the bottles so that the doctor could see, examine them, and then he'll make a determination whether you should continue taking this particular medication. Another thing that's very important, you make sure that on your phone you lock your doctor's office phone number. So when they call you, you know it's them. You could pick up the phone because the doctor might be calling you for example, if you did a lab and they want to adjust your medication, they might be calling you because of that. From your lab, if you're you have an iron deficiency, they may be calling you to let you know that, well, we're going to give you some medication to bring up your iron level up. If your your it, your A1C is high, above the level, which the level is 7. If it's above 7, I believe, then your doctor's going to have to sit down and have a conversation with you. What are we going to do? Are you going to do exercise? Is he going to put you on medication? If he puts you on medication, he'll call you and let you know that, wait a minute, I am going to subscribe this medication for you. You're going to receive it, or call it into your pharmacy for you to go pick it up and for you to start taking that medication. And this is the reason why you getting the medication. So the communication is very important with your primary care, because ultimately they are the one that's going to help you maintain a quality of life. Now, along with them, but you have to do your part. Your part is showing up at your appointment. Follow the doctor's instruction. If you prescribe a medication, take your medication. So those are very key points. And I know you know what I'm talking about. I know you're aware of it. I don't want to feel like I'm really being what's the word? Sometimes even in English I forget words. I'm being chastising you. No, that's not the point that I'm trying to make. The point that I'm trying to make is by providing you with that information, then you are more equipped to make a better decision, to follow instruction, and also become a better patient. And by you becoming a better patient, then you maintain your lifestyle and you live longer. So that's just about what I have regarding that first visit. There's more to it, but be prepared when that first visit. Of course, before I go to the next subject, the other thing that you should be expected to hear from the doctor. Um, in that case, in CAMX Medical Center of Broward, one of the things that we make sure that right away we set up an appointment for optometry because we want to make sure your eyesight is working properly. If you need glasses, then at the time we prescribe glasses. We want to make sure that you have a visit with the heart doctor, make sure your heart is in good condition. We want to make sure that you see the podiatrist if you need to. More importantly, we want to make sure that in the last from I think from the time you're 40, have you had a colonoscopy done? We were talking earlier regarding a patient that we had in the office, and he spent it throughout his whole lifetime didn't have a colonoscopy done. You know, I hear I was recently I was in Orlando, and I spoke with a friend and a family member, and he had not had a colonoscopy done. I'm going, what are you doing? That's very important for you to get done. Especially, I could understand when you were working and you didn't have the wherewithal or the means to get it done. But now you don't have that excuse because you have a Medicare card. The whole idea of having that Medicare card and the Medicare Advantage card is so that it takes away your stress about this bill, about this medical bill, because you don't have a medical bill. They just you just go to the doctor. Even the prep, it's not an easy process. It's not a nice process. Even the prep that I think you may have to get the prep, but it's not that much, maybe $10. In certain cases, we probably send that to you. And we should do that for our patient where the powder that you're supposed to put in the water, we send it to you. There's a pill that you have to drink, so that will help you move your bowel easier. So all that we provided for you, so you don't have to, so it's very necessary. You don't have to spend any money in your pocket for that procedure. It's taken care for you. I think that's where we're going to stay. We're going to stop here, and we'll talk about subject. But make sure that when you go in that first appointment, most importantly, be open with your doctor in terms of your lifestyle so that he could advise you better. The doctor is just an advisor to you, but you have to provide him the right information in order for him to make the best health plan for you. The best health plan for you, because without that information that you're holding, his work is not complete. 305-945-1580, 305-945-1580. So we're going to talk to you about the difference between a supplemental and a Medicare Advantage plan. Most of the company that's going to write you will get a postcard, and it will say on top of it with bold letter, Social Security Supplemental Insurance. That's what it is. They will, if you fill out the card, they will come and visit you. They will set up an appointment with you or call you, set an appointment, you sit down, and they'll go over the different benefits that the supplemental offers. Now, most people, if you have the means, you go with the supplemental. One, you don't have the information, and you feel like, well, it's the supplemental. It's a good deal. Let me explain to you the difference. With the supplemental, there's a cost involved with it. The older you get, the higher the amount goes. So on a monthly basis, you are paying in a range of $300 to $500 a month. The positive part about the supplemental is that if you're a person that travels a lot, you spend 6 months in South Florida, the other 6 months in I venture to say Boston or New York, then when you in New York, you could go see a doctor that accept the supplemental benefit, and you may have just some co-payment, but the doctor will see you. So when you come back down here, you go to the doctor you normally go, they will see you. You could go to see a specialist. You don't need no referral. Just walk in and they take the supplemental. They will see you. However, remember you're paying for the supplemental, which is roughly in a range of $300 to $500 a month. You are paying coming from your Social Security the premium, the Part B premium, which is $174.10. That's coming out of your check. So already you're about $500 to $600 out of pocket. Hospitalization, there's a co-payment involved with it. But the Medicare Advantage plan costs you nothing. The Part B premium that you may or may not have to pay, if you're eligible for Medicaid, the state is going to pay you the Part B premium for you. But the only difference is that with the Medicare Advantage plan, they have a network. What I mean by a network, it's a group of doctors that the Medicare Advantage plan contracted. So they have a contract with the Medicare Advantage plan that every patient that they send to them, they will take care, they will see the patient and take care of all the agreed services at this particular rate. So there's nothing come out of your pocket because that agreement is already made. Medicare provided an amount for that particular patient on a monthly basis, so that the doctor has to do all his due diligence to make sure that that patient stay out of the hospital and stay within that mean that Medicare has set for you. And the way they come about with how much is set for you is based on coding. If you have diabetes, that's one part. If you have high blood pressure, then that's something that take into consideration. If you have cholesterol, that's something else too. Mental disease, and they so on. There's so many. So they take all that into consideration. They come with an amount that they feel that it's needed for you to get service on a monthly basis. Whereas a person that's healthy, May not quote high because that person is a healthy person. They just gonna come in twice a year to get a physical, and that's it. You don't hear anything from them. So a person like that, then what? They may be paying $800 for them. So it varies. That you could have one person that's sitting right next to you, where Medicare is paying $2,000 for that person, where you, that's healthy, they're only paying $800 for you. 305-945-1580, 305-945-1580. So that's the difference. So with the Medicare Advantage plan, oh, by the way, the supplemental does not cover dental. It does not cover optometry, and it does not cover hearing. Whereas the Medicare Advantage plan, they do. The Medicare Advantage plan covers you for all that. Now, the benefits varies from state to state. I often say that I don't see why that aspect of it, you pick one benefits that in a particular state that's been working for everyone in that particular state and make it universal. Like if you see what we have down here in South Florida, that would work perfect for everyone throughout the country. But there's special interest that's involved, so it's hard for you to get everyone to agree on a particular health plan, on a particular plan, on a particular model. You see how much before they came out with Obamacare, or after Obamacare was signed into law, they had so much opposition regarding that. So it's not universal. I always say that you in South Florida, you guys have the best coverage, bar none. When I first started doing this show, I used to get calls from people from Boston asking what can they do to get this benefit in Boston, and I had to tell them that your benefit's totally different. So when you get those cards, think twice before you fill them out, because you want to make sure that you're getting all your benefits. You want to make sure that you're talking with the right people. You want to make sure that when you need help and you dial that number, there's somebody on the other side of the phone that's ready to answer you. 305-945-1580, 305-945-1580. So let's take the time, do your homework. And your homework, I'm not asking you to go sit down and Google Medicare Advantage plan in Florida, because I know there's about 32 or 35 of them. And what they're going to put in front of you, it may look a little bit blurry for you. The wording may not, you may not be able to understand the wording because it's full of legalese. Remember, everyone are trying to protect themselves. Everybody are trying to cover themselves. So those legalese that we're talking about, that when you're reading and you have difficulty understanding them, then we are here to make sense out of that for you. And we'll do that. We'll talk to you. We'll walk you through it so that you have a better understanding of your best choice, your best plan, and how you could benefit from that plan. And one of the things that by the way, the supplemental has the same thing too as the Medicare. If you go to another country and you go to the emergency room, as long the bill does not exceed $50,000, then you come back with your receipt, you submit it to the plan, they will reimburse you your money. So all the Medicare Advantage plan have that part of the plan. They have that as part of the plan. We got another 5 minutes to go, so if you're going to call, call now. Call now with your question. You should have questions. And especially those of you in a couple of months, you'll be 65. You should have questions. You should know what are your options. What are you going to do? I remember a couple of years ago, a very good friend of mine happened to ask me what I do, and I started explaining to her. She said, "I'm going to need you." So I explained to her the process, but she's in New York, and with the information that I provided to her, I hope that she was able to make a better decision. So call if you have to, if you need to. We are here for you on the other side, ready to answer your questions. When it comes down to Medicare Advantage plan, when it comes down to low-income subsidies, how can you get it? So we're going to provide those information to you. We're going to do our best to make sure you're well informed. So when somebody come in front of you and want to talk about Medicare Advantage plan, you're already ahead of the game. I was earlier, a gentleman came to the office, and of course his wife was home, but he put his wife on the phone, and so towards the end of filling out the application, I said to her, I'll be waiting for her when she turned 65. And she said, I'm the one that put my husband up to you. I've been listening to you for a while. So I told my husband once he reached 65, this is the person that he should contact. And we sat down with him. We applied for all the benefits that we feel that it's necessary for him to have. Now, there's one information that you're going to get. There's an 5x7 envelope that's going to come to you. It's going to come from, I think, Department of Health. When you open it, there's an application in there. The application already have your name typed in it. And I think it may have your last four numbers of your Social Security. And it doesn't have your date of birth. You have to put that. And the rest of the information, you have to put the rest of the information. On top of it, it says extra help with prescription drugs. That is the low-income subsidy that the federal government is going to pay a portion of it. So it's vitally important that when you get it, I don't suggest that you fill out the application by yourself. I would suggest that you call us, set up an appointment. It won't take too long for us to fill it out for you, with you, and send it back in. Because that's vitally important. Well, that's all the time that I have today. Once again, it was a pleasure to be here with you today and allow me to spend the time with you while you're in your car, while you're at home. You could always reach me at 954-667-4885. 954-667-4885. Again, it's a pleasure. I love you guys. So see you soon.
Is WSRF 1580 AM W258CZ 99.5 FM Fort Lauderdale, Miami.